Hi, it's Paul Grantham here, consultant clinical psychologist from SDS seminars. You've had a number of questions about the content of our new BPS approved certificate in trauma treatments that's starting soon. It's 4 modules, a total of 8 days, and it's spread over 4 months. Here's what you get when you sign up. As I've already pointed out previously, to our knowledge, it's the only course that provides you with training in trauma treatments from the perspective of a number of different evidence-based modalities. You can sign up now at bit.ly/trauma treatments. Module 1, Trauma, Psychopathology and Treatment. This 2-day course provides a practical and theoretical overview of current approaches to treating trauma from a range of different therapeutic perspectives. It looks, for example, at the somatic therapies, which are explored through the work of Levine, Rothschild, and van der Kolk. These focus on biological explanations and expressions of trauma. The concept, for example, of body and limbic system storage of trauma, including body memories and flashbacks, are looked at in some degree of detail. The key role of Porges' polyvagal theory is also outlined, along with its implications for trauma treatment. Explanations and demonstrations of effective somatic techniques are also given. These are actually designed to eliminate and reduce the client's body memories. If you're curious and want to learn more, well, sign up now at bit.ly/trauma treatments. The course will also help you to differentiate between developmental trauma disorder, simple post-traumatic stress disorder, and complex post-traumatic stress disorder. You're also going to get a good introduction as well to Shapiro's eye movement desensitization and reprocessing, or EMDR, along with its underlying theory of adaptive information processing, or AIP. If you've ever wondered whether the novel eye movement element is a crucial part of the therapy, and whether it differs in its treatment mechanism from CBT, you'll complete the training feeling both more informed and confident about the latest research on this. Is that something that would enhance, extend and refresh your practice? Well, if so, sign up now at bit.ly/trauma treatments. An overview of CBT treatment for trauma is primarily addressed in contrast with other modalities, as detailed training in CBT for PTSD itself is covered in the whole of the second module of the certificate. Its evidence base and conceptual contrast are the main points that are actually focused on in the first module. Throughout the whole of this training module, you'll get numerous video demonstrations of different treatment techniques and approaches so that you'll have a clear understanding of how these approaches can be used in practice. Does this sound like it would be valuable to you? Well, if so, sign up now at bit.ly/trauma treatments. Module 2. CBT for working with post-traumatic stress disorder. The first thing to point out is that this module is also part of the BPS-approved Master Practitioner Diploma in CBT. So for those of you that have already completed this training, you do not have to repeat it, and it means that you've already completed a quarter of the BPS-approved certificate in trauma treatments. This module enables you to do a number of things. It helps you to identify the symptoms of PTSD, and it will help you to choose the right direction and intervention techniques for CBT. The key roles of hyperarousal, reliving, and avoidance are all explained, and you'll also understand the symptoms which are specific to this particular diagnosis. You'll learn how to tell your client about PTSD, when they may not be aware that their symptoms are actually related to it. And you'll also discover how trauma can lead to PTSD symptoms and how to conceptualize a case and explain the often frightening and disabling symptoms to your client. One-off traumas, such as car accidents, require a totally different approach to multiple early abuse, for example. You'll learn how to successfully work with these. Would you like to learn that? Well, if so, sign up now at bit.ly/trauma treatments. You'll also understand different CBT models of PTSD, including Clark and Ellis, and you'll become more familiar with CBT models of PTSD and the brain. You'll be able to differentiate between type 1 and type 2 PTSD and its impact on abuse survivors. Does this sound like something that would enrich your practice? Well, if so, sign up now at bit.ly/trauma treatments. Discussing the trauma in an unstructured conversational way generally doesn't work. Worse, it can actually re-traumatize the client and lead to an increase in distressing symptoms such as flashbacks and dissociation. So, find out what works for PTSD and CBT instead, and be clear how to ensure that you don't actually make things worse. Do you want to know what to do if your client experiences flashbacks? Well, if so, sign up for the course now at bit.ly/trauma treatments. You'll learn about special requirements for working with abuse survivors and how to implement relapse prevention programs. If you're interested, again, sign up now at bit.ly/trauma treatments. This is just about what you're going to get in the first 2 modules of this certificate. I'll be sending you details shortly of what's in the other half. This is the training event of the year on trauma treatments, so please do not miss out. Thank you for your time and take care.